Hi, welcome back to Rohrich Knows Podcast, helping you become a better you. I'm Dr. Rod Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas. Today, let's talk about chins, chin augmentation, and how to do it, what looks good, what looks natural, and what do you use? And there's various different ways of doing chin augmentation. Obviously, the most common way is actually a chin augmentation with a silicone implant, and that's a very tried and true way to do it. But there are other ways of doing it more naturally, using your own fat. And actually, we've written about this in the use of fat grafting for the chin, and I use that a lot when I'm doing a facial rejuvenation or a facelift. And so I'm going to talk a little bit about how to do that, when I use autologous fat, how I do it, and then when do I shift to a chin augmentation with implants. So in general, if it's just a minor augmentation, I'll use fat, either in the lateral chin hollow, the central chin, and also along the mandibular border. And I think it works beautifully to do that. And this just demonstrates that lateral chin hollowing that you can see, and you can do superficial injection of fat in that area, and that works beautifully for that. And it helps to correct that in conjunction with the facelift. And then with central facial rejuvenation, I will use central chin augmentation with fat, again, to augment the chin, especially if the chin is small. And I'll do this in conjunction with a facelift. So this is all done with your own fat. And then even on the mandibular border, especially when I'm doing a facelift, I'm doing mandibular border enhancement, both along the deep border as well as superficially. And then these are some examples of that, a chin augmentation with fat in a facelift patient. And this is a patient who had facelift, and she had chin augmentation. You can see it's a very natural progression, and it looks very, very good, and it's natural, not a chin augmentation, not a silicone implant, even though they are good. Here's another example of a patient that had the same type of procedure, a lift and fill deep plane facelift with a chin augmentation using the patient's own fat. Beautifully done. Here's another patient that has a 3-year post-op with a lift and fill facelift and blepharoplasty, chin augmentation, shaping of the jawline, really beautiful shaping that looks natural and lasts a long time. So I think these are very powerful techniques that you can use your own fat. Your own fat to reshape the jawline, the neck, to shape and that's beautiful. And this works consistently well. The chin augmentation, the lateral jawline, the lateral chin fold, all of these are very powerful techniques that work beautifully. So, and then what if the patient has significant chin microgenia? If it's more than 7 millimeters or so, then you need something more powerful. And that's when I use a silicone implant. And these are very useful procedures that are very powerful, and I do it with a small incision below the chin in this little natural crease. And there's an article that I just published on this in the 7-step, 7-minute chin augmentation. And it works beautifully where you just mark it, you do it at the beginning of a facelift, or you can do it at the beginning of a rhinoplasty. I do it commonly with a facelift and a rhinoplasty, and sometimes I'll do it alone. And obviously I do most of these under general anesthesia. You make a precise pocket, you select the implant, you assess it, and then you close it. And this just is a very short video that goes through that type of procedure. It's a submental incision, and you're basically going down to the menton itself, and you're cauterizing that area, and you're really cleaning that up and making a very precise pocket where you're going to actually go in and you're going to make sure that you get the precise pocket that you want to get the exact implant that you do. So you make the precise pocket dissection. You're doing it with this technique where you're dissecting it out right above the mandibular bone, and you're doing it on the left and right, and you're really shaping it and getting the precise pocket exactly the way you want it, and you're putting it in. And then once you've done that and you've done the precise pocket dissection, then what you're going to do is you're going to get a sizing implant where you're going to actually size it, and then you're going to assess whether you really need that type of implant. Now remember, in a male, and you want to get a more powerful implant. In a female, it's got to be a gentler, softer implant, and maybe tend to undercorrect it. So here's a patient that had a sizer, a small implant. really giving you nice shape and proportionality between the upper lip and lower lip. And in a female, you want to be a little bit behind that upper lip vertical, and then you can actually then go, and then once you said this is the right size, then you take it out and you put in the final implant insertion. You irrigate it, get hemostasis, you put in the implant with a no-touch technique. This is a hard silicone gel implant. These last 30 years or longer, and then you're putting in it the precise pocket, and you're shaping it and really getting it in exactly where you want it. And it gives you the right type of shape and contour when you look at it from the side, the front, and the base view, and it really gives you exactly what you want in the exact precise pocket that you've placed and done it. So this is a really powerful technique and very shapely as well. And you're doing this and you're getting it, look, you're palpating it and you're assessing it. You shouldn't be able to palpate the implant at all. And then you irrigate it, and then you're putting in just a stay suture into the periosteum and into the implant. And that's really all you're doing to the periosteal cuff. You're placing it and you're shaping it in that area, and then you're doing it and closing it in a closed layer fashion. And that really works amazingly well to shape and contour this beautiful area called, chin augmentation in a precise manner. And I think that's really the beauty of this. And then you're then closing it and shaping it and putting in the deep layers and the soft tissue layers, and then you're getting precise shaping and contacting. And really, that's what you want to do with this type of implant. And then you can size it. You can see the dramatic change in the shape of the lower face in this area, and I think it's really remarkable. So here's an example of a patient that had both a rhinoplasty and a chin augmentation. You can see she looks much more natural and shapely, and it really makes the nose and the face balance better. And that's really what you want. You want nasal tip shape and balance, and that's really the beauty of this. Every one of these patients had a rhinoplasty and had a chin augmentation, and it gives an improved postoperative nasal tip and lip and chin balance. And I think that's the beauty of doing these in combination with either a rhinoplasty or a facelift. Really gives you that incredible chin-nose balance that really is unsurpassed. So when do I use a chin implant? When I want to get significant augmentation, more than 7 or 10 millimeters, which is about this much. And if I want less than that, I can balance it with lateral fat augmentation, and that's really beautiful. And here's an example of a patient that's 12 months after her facelift with a chin augmentation, and you can see she's shaped and balanced, and she really contoured her face and neck beautifully, and it really gives you the shape and contour that balances so well and looks natural. And I think that's what you want. You want a natural looking face and chin. So this is a graduated approach on chin augmentation using fat, lateral to lateral chin, jawline, and it's all based upon the preoperative skill, preoperative analysis of the patient to give them a natural look. So the most important thing in chin augmentation is that it should be not overdone, but should be balanced to match the nose, the lips, and the chin and the face, so it looks good. So know before you go. Find a board-certified plastic surgeon that understands facial aging, facial analysis, and nasal analysis to give you the best natural appearance. So know before you go. Please give me your comments and thoughts, and till next time, Rohrich knows. We'll see you next time, and enjoy, and hope you learned a lot from how to balance the chin with the nose and the face.